Hello everybody, it's Laura here. On the 6th of April, the Arise Hub hosted a Twitter chat on disability and COVID-19. It brought together people with disabilities, disabled persons organisations, non-governmental organisations and other experts from around the globe to discuss issues affecting people with disabilities. I'm going to read out to you today a blog that's the fourth in our blog series that summarises the outcomes from these discussions. The blog that I'll talk you through today is about structural violence, ableism and COVID-19. As I'm sure you're aware, COVID-19 presents additional barriers for people with disability that are linked to structural violence and ableism. Unequal global and local political economies and social organisation inflict embodied harm on people, and in this case, disabled people. That is what structural violence is. Ableism is a form of prejudice that characterises people with disability as inferior to the non-disabled, and discrimination is often experienced based on disability and under the assumption of limited capabilities and skills. Yesterday, in the previous blog, we explored how the response to COVID-19 has been hampered because of the failure to include people with disabilities and representative organisations in planning and decision making. Without this expert insight, many of the public health messages and policy prescriptions continue to reflect ableist assumptions. This isn't a small oversight. It leads directly to disproportionate harm on people with disabilities. As Dr. Atib, one of our Twitter contributors, described, people with disabilities are vulnerable to neglect. This may be exaggerated in outbreak contexts. Neglect is not always passive. Sometimes it is an active choice. It is an active choice to continue to organise our societies in ways that discriminate against people with disabilities. Pushing back against this inequity needs to be part of our ways of working as we respond to COVID-19. Let's consider access to personal care. During a Twitter chat, we heard that much of the advice to remain at home with your household and not to mix with people from outside is not possible if you require carers to assist you. COVID-19 planning and messaging has not adequately considered how the pandemic is affecting what care is available as helpers stay at home or become ill. Tweeters were fearful of harm being caused to those who need carers to support them with daily tasks such as bathing and washing, and that is particularly true for people with complex disabilities. Tweeters suggest that policies are adapted to take the needs of people with disabilities into account. For example, the International Disability and Development Consortium suggested that social distancing rules should ensure reasonable accommodations. For example, some children with complex developmental disabilities should be able to leave the house with their parents more according to their needs without the risk of incurring into sanctions. Humanity and Inclusion UK also suggested that we do not apply travel restrictions and social distancing to health organisations or staff that are necessary to maintain essential healthcare and services for everyone, which includes people with disabilities in camps. We can think about this in relation to access to assistive equipment as well. Equipment like wheelchairs and hearing aids and other assistive technologies need to be maintained during the pandemic. Shukuku Aboso, one of our expert tweeters, pointed out that this could be particularly acute for older people who may have been institutionalised in homes and asylums for many years, where they are isolated and often ignored. Community initiatives can be quite important in including participation of people with disabilities. In our Twitter chat, participants explored how people with disabilities may not be prioritised in community-level responses to the pandemic. Healthcare providers and first responders may not be familiar with the rights of disabled people and could exacerbate this problem. For example, Wanja Maina, one of our expert tweeters, described that there is a systematic exclusion of people with disabilities at county levels in Kenya in this response. distribution of sanitisers, soap and community strategies all exclude people with disabilities. Humanity and Inclusion suggested that healthcare personnel need to be fully aware of the rights and needs of people with disabilities to avoid stigma and discrimination, and that they should be trained on how to communicate with persons with disabilities. Another theme that emerged was around decisions about rationing care. Various country protocols created in response to COVID-19 openly discriminate against older people and people with certain disabilities. Some care rationing policies discriminate against people with disabilities who experience serious symptoms of COVID-19, and these challenged Article 10 and 15 of the United Nations Convention on the Rights of People with Disability. Andrea Briegel, another of our expert tweeters, suggested that there are huge concerns around issues of triage and access to intensive care and ventilators. Protocols from various countries openly discriminate against older people and people with certain disabilities. He describes this as a flagrant violation of Articles 10 and 15. Shikuko Obasi added that when ill with COVID-19, persons with disabilities may face additional barriers in seeking healthcare and also experience discrimination and negligence by healthcare personnel. Pandemic responses and recommendations have to take into consideration the rights of people with disabilities. This is particularly important during periods of crisis or shock to the health system, and it is imperative that the needs and values of people with disability are considered now more than ever. We must do all that we can to ensure that people with disabilities have equal opportunity to attain their highest possible right to health during this period and beyond. Thank you for joining me to listen to this blog. Please tune in to another blog tomorrow entitled The Road Ahead: What Can We Do to Support Disability Inclusion in the COVID-19 Response?